Hello, and welcome to the AUA Educator Development Program. This module is on educational assessments. I'm David Joseph, and I'm going to be leading you through this activity today. As an educator, the AUA may ask you at times to write questions for the content that you're working on. This module was developed in order to assist you with that task. At the conclusion of this activity, you should be able to understand why assessments are needed to begin with, specifically multiple choice questions. You should be able to identify the components of the question and understand what a STEM and response do and are supposed to do. You should be given the tools to develop strong questions, avoiding some of the more common pitfalls. And the questions you should develop should effectively confirm that the learning objectives of your activity were achieved. Assessment of educational activity is very important for lifelong learning, but it's also a basic requirement for the accreditation process, specifically related to CME. And the objective of assessments is to confirm that the goals of the activity have been taught to the learner. The most commonly used assessment is the multiple choice question. And throughout this module, I may mention question and always be referring to the multiple choice question. And you'll see MCQ, which also refers to the multiple choice question. Each multiple choice question that's created should be directly tied to or support the learning objectives of the material you're working on. The rest of this module now is going to focus on creating the multiple choice question. The reason multiple choice questions are used are they're an extremely effective way to measure knowledge, particularly pre-test to post-test, to identify that the learner has gained the knowledge you want. In addition, it's also a very effective way to understand what gaps the learner may have. And finally, it's an important measurement of the learning objective itself, seeing if the activity you've created is serving its purpose. The AUA uses assessments and multiple choice questions in all enduring materials, such as the update series online modules. Even live activities will have pre and post tests multiple choice questions. The elements of the multiple choice questions are really two, the STEM and the responses. Within the response, there'll be one correct answer. And as we go through this module, I'm going to go into more detail on how to develop a STEM and the responses and what become good and bad qualities. The STEM will state an issue. You may be describing a clinical scenario. You may ask a question. You may have a clinical scenario that then ends in an incomplete statement. Most commonly, the next step is. The response below will be answering the question or completing the statement. And each question has a particular intent, and the intent becomes its teaching point. And the intent of the questions then results in how complex the question needs to be. And complexity is based on the taxonomy, which I'm going to show you momentarily. Intents differ between products and what you're trying to do. And it also differs between questions within a set activity. For the most part, the accredited activities that you're going to be writing questions for the AUA are going to be done so to confirm that the activity was actually completed by the learner and to confirm that the activity was understood. Well, I mentioned taxonomy. Taxonomy is just the cognitive process of different levels of questions. There's low cognitive process, which is basically recall, and high, where it's clinical judgment. Now, low and recall doesn't mean it's an inappropriate question. It may be very effective, and particularly for certain situations, such as asking an anatomy question, pathology, using a basic recall question is very appropriate. When you're trying to determine whether a learner has actually reviewed the material, recall questions are also very appropriate. When you begin to work into whether a learner has understood the material they've reviewed, you're going to be using some of your interpretive skills and problem solving. The most complex question to write is one of clinical judgment, where you're basing everything off of recall, then you need to interpret what's going on, you need to resolve an issue, and then you may need to direct treatment. Clinical judgment questions are psychometrically very sound and appropriate and extremely difficult to write. And honestly, these are probably better suited for activities that require high stakes exams, maybe certification. For the most part, the questions that you're going to be writing will deal with recall and interpretive and problem solving skills. Before you even begin to write a question, you want to start developing good habits. And this becomes particularly important if you're going to be writing questions for many different activities that you do. The first thing you need to do is know what your requirements are. And by that I mean how many questions you need to write for your activity and how many responses they're asking for each question. Then you need to determine what the intent of your questions are. In most cases, again, you want to confirm that the learner has reviewed the material, but in addition, you want to make sure that they understand. And the goals for those questions will be different. It's also equally important to highlight all the learning objectives within an activity. So if you're asked to do 5 or 6 questions, you want to make sure that that's equally dispersed throughout what the learner has just reviewed and hopefully understood. So continuing with good habits, you want to establish then a central theme for each question once you determine what its intent is. And that theme should be based on what the learner knows, not what they don't. And you're going to see an example of that a little bit later. It also becomes very important to avoid implicit bias. And by what I mean there is that all of you have particular ways that you may manage and treat a patient. And some of that's based on resources available to you, the way you're currently doing things. And it may not cross universally around accepted urologic practice. You want to make sure that the questions you write are very generally accepted and avoid any kind of bias that could be related to geographic areas, gender, or race. So when you begin to build the stem, you want to make sure that it's grammatically correct. And it's helpful to review the stem several times, rereading it. It needs to be clear, precise, based in a positive frame and a present time. And the reason that's important is because for natural learning, and when you're going through a question, the learner is going to think everything in a positive fashion. When you ask a negative question, the learner just naturally first thinks what is correct, what is positive, and then needs to reverse it. It's an additional step and oftentimes can be confusing. You want to make sure that your stem is very concise, and you only want to give the information that's needed, meaning that it should be sufficient to interpret this stem for them to understand the direction you're going and to be able to answer the question or complete the statement that you've mentioned. So you're giving them enough to make a clinical judgment. You definitely want to avoid oversaturation because, again, this is only going to confuse someone. And when you get a stem that's very long, you end up just basically testing reading comprehension, which is not your goal. You do need to provide all the data that's appropriate. And this becomes important if you're giving a lab value. You do need to give the normal values. In this day and age, learners rarely memorize the normal ranges for values unless it's very common. So there's no problem giving a specific result on a value, but then provide the normal range. When you're using abbreviations, make sure that that abbreviation is clearly defined in the activity that you're assessing. Don't use an abbreviation that's very common to yourself, but not available in the learning activity. And then clinical scenarios in your STEM should follow a very common logical progression. And if you're doing it, it could be the start of their clinical problem to bringing up to present day. If you have an incomplete statement, you want to make sure that the response will complete the incomplete statement in a full sentence. The STEM should avoid the negative and accept. And as I mentioned, the negative makes you think backwards, and the same thing with accept. When you have accept, one of the distractors is something that wasn't included in the material, and then the learner is just hunting through material looking for something that's not there. You also want to avoid vague pronouns such as you and keep it very generic. As far as terminology, avoid most useful and best. These are very subjective, can be very controversial in certain areas, so you don't want to do that. And never, always, never works. So you never want to use never and always, and only is the same thing. When you've written your STEM, you want to review it and go back through and see if any of the wording can be ambiguous or misleading or can take a double meaning where it might send the learner down a different pathway. You also would like to avoid a STEM that takes you to a true and false response, because true and false responses are not parallel, and it doesn't really provide an opportunity for the learner to kind of think through the activity or what's best. And finally, you want to prevent yourself from keying in the correct response to either that question by information that's in the STEM, or more commonly, providing the learner with information in one STEM that will then subsequently answer a question in one of their other STEMs, or one of their other questions that they had written. So I'm going to read through this STEM, and I want you just to think about what its intent is and what it's doing, and then we'll talk about it. A 26-year-old woman is in her third trimester and presents with fever, vomiting, and pain. Her white count is 21,000, serum creatinine 1.6 milligrams per deciliter. Her pain is poorly controlled, and she undergoes a prolonged cystoscopy in lithotomy position with stent placement. Postoperatively, her pain is resolved. Her white count is 8,000, her serum creatinine is 0.7 milligrams per deciliter, and she now describes foot drop that is due to. So after you've written your STEM, and think about the one you've just reviewed, is the STEM written in a positive fashion? That STEM actually was. So it's all positive and moving forward. Is the clinical scenario or case history clearly described? Well, the clinical scenario is clearly described, but it actually, when you read through it, it's a simple recall question, which is disguised as a clinical scenario. So then it gets to the point, is the fact for recall clearly requested? And in this situation, it's not. It's blurred by a lot of information that's confusing. Does the STEM contain excessive information? It indeed does. So going back to this question, you say, what was the intent? Well, the author had the intent to confirm completion of the activity. And basically, this may have been an activity that was looking at complications of lithotomy position, and you needed to know what nerve was involved with foot drop. Well, if that's the case, and it's simply a recall question, what nerve when compressed causes foot drop, you can change that question and whittle it down, that STEM, and whittle it down to this. The only thing preserved is the nerve compressed during prolonged lithotomy position that causes foot drop is and then leave the responses. So again, going through something, clearly identifying what your intent is, and then making sure that you've conveyed that to the learner. So after each STEM, You again ask yourself, does the format of the STEM meet the intent that you've written the question for? And if it's recall, make sure that the content that you're asking the learner to identify is within the material. And don't bury it within an image or a table. Make sure it's clearly available so they can see it. If you're confirming understanding, you want to then create a question that has interpretive skills and problem solving. Moving on to the responses. The AUA in most cases will require 4 responses. You might be asked sometime in the future to write 5 responses for a question. There's good psychometric and statistical knowledge to know that if a question is written well, whether you have 4 responses or 5 does not really matter. So writing 4 responses, if it's meeting your goal, will be very effective. So within that, you want to make sure that one of the responses you write is indisputably correct. And it's very common that you can have a lot of content experts working on a particular question, all feeling very confident that they have the one correct answer. It completes the STEM. But then there might be some learner that actually questions it. And upon review of that, you determine that maybe that learner is not incorrect. Maybe that wasn't an indisputably correct answer. So that's where you don't want to be vague, and you don't want to use the most likely, the best, the most probable, because again, those all are left to suggestions. The 3 other distractors all need to be logical misconceptions, because the learner should be looking through and actually determining why the other questions or the other responses don't answer the question. All of the responses that you write must have what's called face and content validity. And what's meant by that is they need to be practical, relevant, and appropriate for the intent of the question. Look at this question and responses, and just look for a second and see if you can pick up something that doesn't fit. The next imaging study is, well, C, IVP. It's no longer clinically valid. Many of your learners probably don't even know what an IVP is. It should be described as an IVU, or an intravenous urogram. And it's exceedingly rare that anyone uses an intravenous urogram to date. So you want to make sure that all of your distractors are plausible and legitimate, because if they're not, the smart learner will completely remove it from their thought process. So good responses are all plausible. They have face and content validity. They're similar, or what we also call as parallel in content, meaning if you have 4 responses, you want them all to be diagnoses or all treatment. You don't want to have 3 diagnoses and 1 treatment, because that treatment will stick out in most cases and either draw the attention of the learner where they're going to answer it positively, or they'll exclude it. You want to avoid repetition between your responses. You want to make sure that they are mutually exclusive, and this becomes a problem that's most often seen when you're trying to identify percentages when a potential problem occurs. There's also a logical process that you want to go when you're presenting your responses, going from the least to the most, either invasive or complex, because that's the way your mind works. When you're reading through something, you're going to think of simple responses and then moving through. You want to make sure that your responses are grammatically correct and complete the answer of the STEM. And while important but not as critical as the other is trying to have responses that are similar in length. So I'm going to go through 3 questions here, and I would like you to determine what the answer is, and then we're going to review them. So the square root of 22 is, next question, the square root of 16 is, and the final question, how many urologists does it take to write a good question? All right. Things to avoid in responses are none of the above, anything like A and C, all of the above, and overlap. And each one of those examples that I gave you contains one of these issues. So here, the first one, the square root of 22. I would suspect that each one of you knew very quickly that the answer was E, none of the above. And I also would bet that none of you know what the square root of 22 is. And this is an example of asking a question but not getting the answer. So you can answer this question correctly, and you still don't know what the square root of 22 is. And that should be avoided. And that's where none of the above becomes a problem, because you're not asking them to really tell you what the answer is. The square root of 16 is, well, very quickly you're going to know it's 4. So you see C is 4. You look down, all of the above. Well, all of the above, you need to have at least one more that's going to be correct. You go to A, and obviously that's 4. And that means that you don't even have to review your responses B and D. While both are correct, they don't need to be considered. So you've taken a question with, in this case, 5 responses and really whittled it down to only 3. And finally, how many urologists does it take to write a good question? Obvious overlap here. If it was 3, you'd have correct response with A and B. 9 would be C and D. And if it were 12, D and E. So they are not mutually exclusive. Response structure also should have the logical order that I mentioned, going from least invasive or complex to most invasive or complex. All of these are parallel, meaning they're all treatment and they're all an effective response. But they don't follow a particular order where you have the most complicated first and then you go through and have something easier. So when you see something like this, rearranging it into this fashion, observation, antibiotics, percutaneous drainage, cystoscopy with stent, open nephrectomy, just follows a pattern again from least and most. And that's going to be easier for the learner to understand. You also want to try to remove unnecessary repetition. And this is pretty common, and it just adds something else for the learner to read, which is really not needed. Foot drop occurred due to compression of, in each one of these cases, the is put in and nerve is put in. You can simply rewrite this question to eliminate that and make it more straightforward. Compression of this nerve causes foot drop, and then give the answer. Response structure symmetry is helpful but not critical, and I wouldn't spend a great deal of time on it. I wanted to just show you some examples of what it can do. In this first case here, you see all of these have kind of an enlarging order of response and then drops back down. When you're reviewing a question, your eye naturally goes first to the longest answer, particularly if it's out of line with everything else. So if you look down at this question here, you can see that the last answer, laparoscopic calyceal diverticulectomy, is the longest. That's what the learner is going to first focus on. Now, it may be appropriate to put in that location if you're dealing with complexity, but on the other hand, you may need to shift it around. In this example here, you have 4 responses that deal with a pathway, and then one that seems to be out of line. It deals with the meat consumption. Now, maybe these are parallel depending on the way the question is written, but it just doesn't appear that way. And most learners will look at the response E and consider it as odd man out in a sense. In the middle, you see two responses that look very good, and they could be very good, but both are answer C. For the material you're writing, it's not going to be critical that you have all responses in one of the various formats, but it's nice to vary things a little bit, particularly if you're writing questions for an activity that has multiple questions present. So you look through these two and you say, well, can one be changed? Well, in this first one over here, you can see this follows symmetry. It also has some semblance of logic to it, and you really don't want to move any of those distractors. When you move over here, you see that all of these are similar and parallel. It would be very simple to move distractor C into a position of A, B, or E. And again, this isn't critical for what you're doing, but it's just some things that are helpful and important. Again, your eye likes symmetry, so creating a responses that kind of gets larger and then smaller is effective, staying the same size is effective, being one that's kind of in this shape where it's pyramidal can be effective. So in summary, some of the practical points: you want to maintain a perspective on the activity that's being assessed. You want to make sure that you define the intent of each question. You want to make sure that you have a correct answer, and that that correct answer clearly is represented in the content if you're looking to whether they've accomplished the goal of doing that content, and that it's not hidden in a table. You want to make sure that the correct answer is the only correct answer that would potentially answer a question of problem solving or interpretive skills. You want to make sure that your teaching points have all been clearly addressed, and you're making no intent to trick the learner. Again, I can't stress enough that it's important to question the learner on what they know, not what they don't know. Beyond writing questions, there are other learning opportunities, and the AUA may ask you at time to provide an explanation for your question, and this can become very helpful and actually can become the most important factor of that learning activity. Explanations and comments are critical for particularly lifelong learning, and very helpful to the learner. The learner wants to know why the question is correct. And if you've written the distractors appropriately, where they're logical misconceptions, they want to know why that distractor is incorrect. So that's very helpful. So now, fulfilling our requirements, I'm going to give you a post-test on what you've learned. So we'll go back to one of the previous questions. How many urologists does it take to write a good question? One, hopefully, after completing this teaching session. So I want to thank you for your time in working through this module. I hope it's going to help you create multiple choice questions that are valid. And I'd like to draw your attention to visit the AUA University for more resources, particularly finding the multiple choice question template that's going to be used when you're developing assessment questions. Have a good day.